Right, well, some of you will remember me from last year, and might have given you some shocking information, but, but hopefully it was enough to spur you on to actually want to be healthy. This year I'm going to give you some health tips just for sort of things you can do in the car and also outside as well, and why you need to do them. Just a quick bit about me. I'm a nurse. I run a health screening company in Bedford, same place as my name. And I have a real passion, a real love for helping people learn how they can prevent becoming ill. And there's an awful lot that we can do ourselves. So hopefully you'll learn quite a bit from this, or at least it'll spur you on to actually do something. If you do want some more details, I won't be able to go into too much detail, but if you want some more details about things, there's a pamphlet that you can download from my website, which is about sort of healthy lifestyle recommendations, and I'll give you the address for that at the end. Right, so what are the potential health hazards that you're going to likely to come across as being a driving instructor? Right, these are some of the 5 most obvious ones, really. Dehydration. Okay, fatigue, weight gain, infectious diseases like colds and flu, and thinking of swine flu, and stress. So we'll start with dehydration. So what are the symptoms? You get a dry mouth, increased thirst, and incidentally, as you get older, you actually lose some of the thirst reflex. So sometimes you might have a dry mouth, but you actually don't feel particularly thirsty. And occasionally you can feel thirsty, and it actually you think you feel hungry, but it's actually telling you that you actually feel you need to drink. Fatigue is one of the symptoms of dehydration, and then progressing on, you can actually start to feel quite dizzy, and even get palpitations. So not a good thing to come across. And what are the long-term consequences of that? Well, something like kidney stones. When you're dehydrated, the salts that are in your blood and in your body, they can get concentrated, and then they start to form stones. So that is one of the long-term consequences of chronic dehydration. You can also get digestive problems. Again, water is often taken away from parts of the body, go to the vital parts to make you function properly, especially like to the brain. And it's taken away from the digestive system. So when you're trying to digest food, it can digest it more or less efficiently, and therefore you can get digestive problems. High blood pressure as well. Your blood actually becomes slightly thicker if you're dehydrated, and therefore it's harder to get pumped around the body, and that can cause damage to the blood vessels and lead to high blood pressure, and that then leads on to heart disease, cardiovascular disease. And then you can also get back and joint pains as well, because being dehydrated, chronically dehydrated, the fluids that make your joints that move nice and easily, they actually are much thicker and less efficient. And also your discs in your lumbar vertebrae, well, all the vertebrae between each of the bones, they actually become more desiccated, so they're dried out, and so therefore less spongy. Right, so prevention tips. Well, drink 2 litres of water a day. I think we're told this so often. Obviously a bit more in the summer. You need to probably take a bottle of water with you in the car. I mean, that's always a good idea, having a bottle of water in the car, and just take regular sips whenever you think about it. Sort of a nice big gulp maybe between clients. But it's just trying to remember, just make sure you've got some water with you. Avoid fizzy or sugary drinks. These tend to dehydrate you. Just the sugar itself, it makes you more acidic, and therefore you need more fluid in your body to be able to balance that, to make you more alkaline. Avoid salty snacks. They again can be dehydrating. Everyone knows if you have salty things, it makes you want to drink more. and limit your caffeine consumption. Caffeine has a diuretic effect, so it actually makes you want to go to the loo or pass water more than normal. So it makes you do it. It's like the drugs that you can get, diuretics. And again, you need to replace that water as soon as possible. So next thing is fatigue. Okay, so prevention tips for that: avoid dehydration. So we already know about that one. Eat regularly. So you're avoiding low blood sugar. The brain needs glucose for it to be able to operate properly. So hopefully you all had your breakfast this morning, because otherwise you're not going to be able to listen and take in everything as easily, because it makes you mentally tired as well. So not just physically tired, but mentally tired. So you do need to eat regularly. Get some fresh air. So when you can get out the car, between clients. Some people might just wait in the car for their client to come to them. Maybe you should actually get out of the car, take a few big deep breaths, and go and get your client. Also, the oxygen that you're getting from the air will help to stimulate you and take away some of that fatigue. Exercise. What that does is it pumps the blood around your system, and it helps to remove toxins. And toxins that are in your body can also affect how you're feeling. Your body's working overtime trying to get rid of the toxins. So exercise will really, really help there. Now, how you do that, it's really up to you. But really, it's trying to take opportunities where you can, walking where you can, sort of taking the stairs rather than the lift. It's just finding opportunities where you can do a little bit more than what you'd normally would do. And an acupressure technique. Now, that might sound a bit intriguing. So there we go. There's a little thing that you can do that might help and might not, but it's worth a try anyway. Acupressure, it's a bit like acupuncture, but it's without the needles, so you might be a little bit more appealing. And what you can do is locate on your hand that spot. I hope you can see the little tiny red spot. It's on the middle finger, just by the root there. And if you just sort of press that, and help to rub that, massage that, that can actually help to make you at least more mentally alert, okay, or less fatigued. So, simple little thing that might help. It also recommends sort of tapping your finger on the dashboard or whatever you've got as well. So, simple little thing. Right, and then weight gain. Okay, right, long-term consequences of weight gain. Really nasty things here. Diabetes. That would be type 2 diabetes. It's the late onset diabetes, as they call it. And particularly if you're very fat, sort of got a lot of fat around your middle, you're at higher risk of diabetes. Heart disease. Well, the heart has to pump a lot harder when you're overweight. So therefore, that can actually cause or lead on to heart disease. Joint disease as well, because obviously the extra weight you're carrying is putting more pressure, particularly on your hip joints and your knee joints. So that doesn't really help you. You can get a lot of pain, arthritis, that sort of thing. And then worst case scenario is cancer. And part of that is because the fat cells tend to accumulate all the toxins. And of course, when you've got a very toxic body, then very often cancer can develop from there. So something you don't want to have. And because your job itself, you are sitting in your car a lot of the time, it's considered to be a sedentary job. And therefore that puts you more at risk of putting on weight. So just bear that in mind. And some of you may have come from a fairly physical job and then chosen to become driving instructors. And you may notice that the pounds have started to go on.